here we go. We're recording for prosperity. It's a shop. Okay, is it an online shop, Connie? Or is it a shop somewhere in Dublin or London or something like that? I've never heard of it. But anyway, it's a normal shop. Where is it, Connie? I've never heard of it. It's in Cork. Okay. Okay. All right. Okay, Naheed, that's great. You know where it is. So that's a shop in Cork where you can, anyone from Cork City, where you can go in and buy those things. I had nasal oil, but I sneeze a lot after using it. Yeah, and that's great. That's what you want to be doing. Getting rid of everything from in there. Sneeze away, you know. So it's a good thing when you sneeze. But we don't have a Mr. Price in the UK. Yeah, but I'm sure you have stainless steel pots. You can get them somewhere, you know. So I'm sure you had all over Ireland, chain of shops. My God, that's amazing. I've never heard of it. It's not in Drogheda anyway, but hopefully it'll come here. What is your YouTube channel called? It's called the Ayurveda Center. So go to the Ayurveda website, and just on the home page, there's a link to our YouTube channel, and just click on that and it'll bring you in there, and subscribe and click the bell, ring the bell we put lots of videos up there. Anyone that's done our courses gets a link, and that brings you to our YouTube channel. So, so yeah, but you should subscribe to it because we're putting stuff up there all the time. So there's one in Dublin and Santry. Thanks for that. Okay, I haven't been out in a while, so obviously I've missed those things. I do Triphala eye wash 3 times weekly, especially after being outside. Yeah, okay, good for COVID kick out. Is goat ghee a real Ayurvedic thing? Anna Carey, never heard of it, Anna. Never heard of it. But I suppose there's no reason why you couldn't make it, but I'm not too sure what the properties of it would be. Recently seen it advertised. Actually, I saw that Avonmore are now selling ghee in Ireland. I couldn't believe it when my brother showed me the ad the other day, in a little tub of Avonmore Irish butter ghee, clarified butter. And, you know, in the same tub like a margarine. That's the only thing I didn't like. I'd prefer it in a glass jar. But it was just fantastic to see that it's for sale. Now, I have never seen it in the shops. I just saw an advertisement for it. But it was an Avonmore product made with unsalted butter. So just shows you. And it's very easy to make ghee. And we do have a video on our website of how to make that. And you can use that to clean your eyes. That's Netratharpana, which I'm sure Dr. Naheed will talk about, you know. Okay, you can make your own Triphala eye wash, you know, just with Triphala powder. Okay, so what have we? We got 2:20 on, and it's 19:37. I think we should kick off, Dr. Naheed. Are you there? Oh. Dr. Naheed?
Hello? Yes, I was muted.
We lost you there for a while. How did you get muted? I must have muted you by mistake.
Oh, there was some unstable internet. That's why maybe.
Okay.
Dr. Don, yeah.
Dr. Brennan's there, is he?
Yeah.
We'll say hello to him. How you, Don?
How you, Noel? How you, Naheed? Naheed, your bliss balls were brilliant.
Thank you.
Your bliss balls were gorgeous. Just equal quantities of raisins, dates, nuts, seeds, blended with a little ghee, and made lovely little balls. I rolled them in coconut, desiccated coconut, and they were gorgeous.
Well, that's great now, Don. You hang on to a few of them for Friday, okay?
No way. 3 left. They'll be gone by Friday.
And make some more. Okay. Good to see you, Don. I think maybe we should get started. It's time is moving on.
I'll disappear because
2:24 on.
I'm here to learn.
Thanks, Dr. Don, for joining. Thank you.
Well, thank you. I'm looking forward to it.
Well, I'm on mute, Don. Yeah. Okay. Okay, Dr. Naheed, say something there so you come back up on the screen.
Hi.
Yeah. Okay, you're back up on the screen. I think we'll press on, Dr. Naheed. I know there's another 35 people to come on, but maybe some of them are just going to watch the recording, you know. Yeah, you fire ahead. So I think everybody knows Dr. Naheed. Well, maybe they don't, so I'll introduce Dr. Naheed. Dr. Naheed is an Ayurvedic doctor. In India, to become an Ayurvedic doctor, it's a 6-year degree course. So it's quite a long term of study, and then followed by working in various hospitals and various different places. She's a gold medal winner in Ayurvedic herbs as well. And she moved to Ireland. How long did you come to Ireland, Naheed? It's about 2 years now, is it?
2.5 years. 2.5 years.
2.5 years, and she's been working out of Cork. She's been working with the Ayurveda Centre out of Cork for about the last 2 years or so. She had to go back to India. She's in India now. I'm hoping the internet connection is stays strong enough for us, but she's in India now, and hopefully she'll be back in Ireland when the time is right. But she's a very experienced Ayurvedic doctor, and she's going to talk on this topic of ears, eyes, nose, throat, and then we're adding in the skin as well as an extra bonus, you know. Okay, Dr. Naheed, I'll let you go ahead.
Thank you, Noel, and thank you everyone, and welcome along to our webinar. I would like to share my screen.
There's a bit of background noise there, Dr. Naheed. I'm not sure what it was.
Is it still coming?
No, it stopped.
Can you able me to share my
screen? Okay, sorry, yeah. Okay, you should be able to share your screen now.
No, host disabled participant screen sharing.
And try again. I have shared screen open now.
Yeah.
Okay, we're on.
Yeah, thank you. Okay, so today we are going to discuss about the care of our senses, which is ear, eyes, nose, tongue, and skin. So I start my slideshow with that. So as we all know that the doshas evolved from the 5 basic elements. Similarly, our senses has also evolved from the 5 basic elements. From the space element, the sense of hearing evolved, which is the object of ear, and from the air element, the sense of touch evolved, which is the object of skin, and from the element fire, the vision, the visual perception evolved, which is the object of our eyes, and from the water element, the senses of taste evolved, which is the object of our tongue, and from the earth element, the sense of smell evolved, which is the object of our nose. So I think we should start with our eyes, which is the most used and most important organ. So the first thing we do in the morning is we open our eyes and then we start our day. Eye is the organ of Pitta, and Alocha Pitta is responsible for our vision. Some common problems in day-to-day life with our eyes are, it can be itchy eyes, it can be watery eyes, it can be dry eyes, or it can be, painful eyes after spending a lot of hours on the screen. But all these minor simple symptoms can be the premonitory symptoms of a terrifying condition.
Sorry, Dr. Naheed. Sorry for interrupting you. There's something happening here. There's a noise, a background noise coming in. So what I'm just going to go back and I'm going to mute everybody in case somebody came on that wasn't muted. Okay. So I muted everybody, including you. So I'll have to unmute you now. Okay, so I'm just unmuting you, Dr. Naheed. Everybody else should be muted. Can you hear me? Can you hear me?
I can. Can you hear me?
Yeah, I can hear you. There's just some sort of a...
Can you hear me?
Yeah, I can hear you, yeah. There's just some sort of a background noise coming in there. Okay, the other thing I'd ask everybody to do... Sorry? I can hear you, Dr. Naheed.
Can you still hear some background noise?
It's kind of, I don't know, it's a very strange kind of a background noise. It's not like a normal background noise. It's like some shuffling or something like that, some electrical thing nearly, you know. Let's just see. It sounds like Dr. Naheed's notes being too near to the mic. Have you got notes very close to the mic? Paper or anything like that?
No.
Yeah, it's like a...
Or it can be my air condition.
It can be which?
My air condition, maybe. I don't know. My AC. I don't know.
It sounded like a cable or a notes or something very close, something very loose or something very moving when the thing is something touching the mic. Exactly. That's what Nirma says. It sounds like something touching the mic. You haven't got any cloth near the mic or anything like that, no? You're no.
No,
Okay.
nothing.
Okay, we'll keep going. Maybe when I mute, maybe it was coming from outside. We'll keep going, and I'll just keep an eye on it. So the other thing I'll ask people to do, because we find it makes the thing better, is that if everybody can switch off their own video, just switch off their own camera, uh, for the duration of the talk. When we go to Q&A, we can put it back on, but that tends to have a positive effect on the connectivity, because there's a lot of people on. So we'll go ahead, Dr. Naheed. I'll keep an eye on it, and we'll just see. But it was quite loud, so we'll just see if it's gone now. So go ahead and share again.
Okay. So we start with air, which is the most important and most used organ. And some common problems with eyes can be itchy eyes, painful eyes, or it can be watery eyes, or it can be redness of the eyes. But all these simple symptoms can be the premonitory symptoms of a very terrifying and painful condition, which is loss of vision. So how we can take care of our eyes, as per Ayurveda, and as per modern science as well, pupil is the center of vision, and Ayurveda has categorized pupil into 4 different layers. When the doshas affect each layer, different kind of deformities with the vision start appearing. So when dosha accumulates or affect the first layer, there can be hazy vision. We are not able to see clearly and properly. When it affects the second layer, we are unable to judge the distance of the object. So maybe a far object can appear very near, or a near object can appear very far. Or maybe it has given an example that it becomes really difficult to look into the mouth of the niggle, the hole in the niggle. And when doshas affect the third layer, then it becomes very difficult to judge the number of the object. So maybe it becomes blur, and one object can appear as 2 and two object can appear as 3. And the vision is so blurred when the doshas keep going inside in the third layer. Like if you see a person from far, you'll not be able to see his ears, his eyes, and his nose. And when finally the doshas affect the fourth layer, there will be loss of visual perception, and only bright illuminating objects like lightning, thunderstorms can be visible. But as Ayurveda emphasis more on the preventive care, Ayurveda has given a lot of things, a lot of remedies and herbs. With the regular use of that, we can protect our vision, we can improve our vision, and we can delay age related vision loss. So what are those? As the eye is the vision, and it's related to pitta organ, so we need to focus on a diet and a lifestyle which balances and keep our pitta in balance. Like taste of the food should be sweet, bitter, and astringent. And from the nutrition point of view, vitamin A, C, E, zinc, and beta carotene are important for a good vision and improved vision, and that can be easily sourced with vegetables like carrot, sweet potato, spinach, and kale. And if we see this vegetables from pitta point of view also, then carrot and sweet potato being sweet help to balance pitta. Spinach and kale being astringent helps to balance pitta. And some of the citrus fruit in moderation so that you can get enough of vitamin C. And we need to introduce more of our healthy fats which contain omega-3 fatty acid, and they can be sourced from ghee, and ghee is an excellent option to keep your pitta in balance. And that can also be sourced from nuts like walnuts, Brazil nuts, and they are also a good source of vitamin E as well. Chia seeds, flax seeds, and hemp seeds are also rich in omega 3 fatty acid, and as well as lentils. Some of the spices can help you to strengthen your vision are like ginger and turmeric. You can use them for your cooking, you can use them along with your milk, or you can make herbal tea out of that. Herbs like triphala, most of you know the importance of triphala with the eye care. And along with Triphala, the another important herb is licorice, which is also known as Yashki Madhu. So regular use of Triphala and licorice can help you to improve your vision. And Ayurveda has given some daily practice regime as well to improve our vision. So when you go to the bathroom in the morning, you fill your mouth with water and splash some cold water in your eyes, because the cold water is cool and pitta being the hot. So opposite will help you to balance your pitta. Nasya, so any disease, any problem above our neck region, nasya can be a great cure for them, and all the sense organ can get benefit from the regular use of nasya. Foot massage, it's very important. So when you do a oil massage on your foot and you with the pulp of your thumb you press all over your foot, then you increase the blood circulation, you stimulate the nerve supply, and some of the vital spots are there, you're stimulating them by just pressing over there. And some eye exercises are also beneficial to improve your vision, is that you slowly blink your eyes 10 to 15 times, and you move your eyes up and down, or you move your eyes sidewise, and then you move your eyes in a circular way, in a curling way, and you need to focus something very far or something very near. You can use your finger for that, or you can use the tip of your nose for that. But if you have to work long hours in front of the screen, then you can rub your palms and to generate some heat, and put your palms just like in the picture above your head, above your eyes. That will give you, a very relaxing kind of feeling. Pranayama, like hummingbird Brahmari pranayama, can also help to improve your vision. And during the daytime, try to protect your eyes from the sun by wearing a good sunglasses and from the hot fumes as well. So hot fumes, it means that smoking is just not good for your eyes. Smoking leads to the damage of your optic nerves and also deteriorate the retina. So there can be loss of vision if you are a chain smoker. And reduce your screen time, so take a break in between your screen time, maybe just after 20 minutes you look you look away from your screen for 20 seconds. And when you do all these exercises, you don't do all of the exercises at a start. You start with just blinking your eyes, then after 1 or 2 days you just do up and down movements, and then slowly you introduce each exercises to your eyes. If you do all of them together, then that can strain your eyes and that can put a lot of pressure on your eyes. And for the night practice, you can have Triphala with ghee. So Ayurvedic text, many Ayurvedic texts has mentioned the importance of Triphala in relation to the eye care. And if you consume Triphala, half a teaspoon with 1 teaspoon of ghee, by mixing it very properly, making like a paste every night, then that can improve your vision, and that will also prevent any kind of degeneration with your vision. Ayurveda has also explained many therapies related to eyes. So actually, if I count the number, then 7 different kinds of therapies has been mentioned in Ayurvedic text for improved vision and for the cure of different kind of eye disease and eye conditions. So the first one is eye bath, which is also known as tarpana. This eye bath is done with ghee. There are herbal ghees, there are medicated specialized ghees for this purpose. So bridge is kind of bridge, as you can see in the picture, is made around the eyes using gram flour, and ghee is poured in that warm ghee, and they let it be there for a while. When the temperature reduces and comes to normal room temperature, then the ghee taken out from that, and another batch of ghee, warm ghee, is kept over there. And this process usually runs for 30 to 45 minutes. But this therapy is to be done under someone's supervision. But I have stockpiled some of the feasible way how you can do that at home. So you can simply take melted ghee and you can massage all over for 5 to 10 minutes around your eyes, for each eyes. Or you can take a cotton pad and you dip it in a melted warm ghee. You squeeze it a little bit so that it doesn't drip from here, and you place it over your eyes and let it be there for 5 to 10 minutes, and then remove your eye pads and very gently wash your eyes with a very fine muslin cloth. Or the best way to do that, which Dr. Brennan has suggested me, is that the Optrex eye bath comes with a cap. So you put your melted ghee in that Optrex bath cap and you place it over your eyes and you let it be there for a few minutes and you just shake it out. So this therapy is very useful in conditions like dry eyes, like glaucoma, loss of vision, watery eyes. And there are some precautions to be taken when you are doing this therapy. You need to do it in a room which is not too bright, that has very minimal light. And after doing this therapy, don't rub your eyes. Very gently wipe it with a very fine, very soft cloth and remain in that dark room for a while, because eyes becomes rarely sensitive after doing this therapy. You will not be able to see clearly, the vision will be blurred, so be at rest for a while, for a few minutes, and then come out of the room and then be in the bright light, or turn on the light. The second one is also a eye bath. It's just that the liquid which is used for this process is not ghee. That's a decoction, which is prepared with a very, sophisticated manner. So I'm not going in detail for that. So the third one is an eye wash. For this, you can use either warm milk or you can prepare your triphala or licorice decoction, and you can simply wash your eyes either by splashing over your eyes or with a dropper. You just continuously pour liquid over your eyes for few minutes. This is usual in infective condition, in redness of eyes, and in conditions like swelling of the eyes. And the fourth one is eye drop. So all of us are familiar with eye drop. Eye drops are widely available in all of the pharmacies, but you can prepare your own eye drop with triphala quat or licorice decoction. So for that, when you are making your decoction, either with triphala or with licorice, you need to reduce that decoction till it reduces to 1/4 part. So if you're using 50 ml of water, then it should only remain 12 ml of water. And you can take a dropper and you can put it in your eyes when the liquid comes into room temperature. So there are two precautions to be taken, even if you are using a normal eyedropper from the pharmacy or if you are making it and doing it at home. It should always be poured in the center of the eyes, and there should be a distance of your own two finger between the dropper and the eyes. And the fifth one is the poultice. So you need to tie herb in a cotton cloth and you just place it over your eyes. You know, some people do that with tea bags. They use the old tea bags, use tea bags over the eyes to reduce dark circle and all. For this, you can use herbs like neem. You can use herbs like dry ginger. You can use licorice. You can either use triphala. I have written a detailed recipe of each of the therapy in the handout. You will be able to follow them. Uh, and this poultice therapy is useful in condition like if you're just looking to give some extra relief to your eyes, if your eyes is very strained, very stretched out, if you feel a lot of pressure in your eyes. So at the end of the day, you just tie your herbs and you just put it in your eyes. And the sixth one is the eye mask. So you make a thick paste and a smooth paste out of the herbs and you apply it all over the eyes, leaving your eyelashes. And this eye mask therapy is useful in conditions like swelling and itchy eyes. So I remember someone was asking me about the style, that what can be done. So you can make paste, a thick paste using herbs. I have mentioned the name of each of the herbs in the handout, and you just apply all over the eyes. You can practice this 2 to 3 times in a week, and that will help to reduce your itching and swelling condition of the eyes. The seventh one is collyrium. So it's like a kohl, like we use in makeup to apply in the lower eyelid, that to be done under someone's supervision. So I am also not going in detail for that, and that has to be applied with a metal rod. So I'm not going in detail because it requires residential and someone's supervision to do that. Now let's move to the air. Air is the organ of vata, and some of the common problems with air can be earache. A very common problem is tinnitus. The another problem can be discharge of your ears. There can be itchy ears, that you might feel blocked ears because of the impacted wax inside that, or maybe some infective condition, or maybe a kind of discharge, or like watery kind of discharge, or maybe pus kind of discharge is coming from the ears. Or maybe with the age we gradually lose the visual perception. We are not able to hear like we used to hear in that young age. Or why that happens, it's because in the old stage we are already in the vata phase of the life, and there is very less prana. So in this increased vata and less prana gradually reduce our power of hearing, and we ultimately lose the power of hearing. But with the wisdom of Ayurveda, we can definitely keep our vata in balance. We can introduce more of a prana in our body, and we can prevent our hearing loss. So some of the daily practice of the ear can be ear drops in the ear. So in the early morning, when you are doing all your rituals like abhyanga, nasya, oil pulling, along with that, you take a dropper, a clean, sterile dropper, and you put oil inside your ears. Maybe 1 or 2 drops. So you start just with 1 drop, and if you are not sure with the dropper, then you simply take some oil in your little finger and you try to apply as inside as far as possible inside the ear. The second one is nasya. So nasya is good for all the senses, not only for the nose. So it helps to also improve your hearing capacity as well. Oil pulling is has a very significant role in your hearing aids, in your ears as well, because you are taking oil in your mouth, and anything which is oily helps to keep your vata in balance. Pranayama and meditation. So pranayama helps to introduce more of a prana, more of a vital force. It infuses all your cells and tissue with more of a oxygen, so you are introducing yourself with more of a prana, and keeping your vata in balance. As vata is the organ, as ear is the organ of vata, so you definitely need to protect it from cold wind and cold water, especially during the winter season. You wear your cap, you wear your beanie, your muffler, and when you're going on swimming, so protect your ear to not catch cold when you're doing swimming or during the winter season. And diet, so you need to introduce more of a vata balancing diet. So you prefer foods which are sweet, sour, and salty in taste, and the foods which are dry, light, and astringent, you need to be avoiding all those foods. You need to add more of a prana enhancing food in your diet, like ghee, milk, and honey. Ayurveda has also recommended for the air care meat soups, but that totally depends on you how comfortable you are taking the meat soup. You can use meat soups as the medicinal purpose, and it has put a great emphasis on taking more of a sour taste food, because sour takes help to keep your vata in balance. So you can have citrus fruit, you can have fermented foods in moderation, to introduce more of a sour taste in your diet. Or you can maybe try with chutney, mint chutney, or maybe coriander chutney, along with tamarinds and lemon. And some of the warming and vata balancing spices like ginger, cinnamon, cardamom, and garlics. You can use ginger, cinnamon, and cardamom either to make your herbal tea, or you can use them along with turmeric in your golden milk before you go to bed at night. And herbs like ashwagandha and bala, they are excellent to balance your vata. Rasayana like Maharishi Amrit Kalash 5 helps to rejuvenate yourself, gives you, enlivens you, and provides supplements. They help you to build up more of a rasa, the first body tissue, so that you can make all your tissue healthy and more of a ojas. And if you're suffering and dealing with some chronic condition like tinnitus and on and off earaches are there, then you can have castor oil 5 to 10 ml at bedtime. They will help you to bring your vata from the upper part of the body to bring down in the lower part of the body. And one of the herb which is very beneficial in condition related to ear is bilwa. So when we can't hear properly, what happens that vata along with the kapha blocks our channels, which helps in the sound perception. Bilva helps to balance your vata and kapha as well, and also helps to clear the channels. Bilwa is widely used in India and in many medical practice as a herbal oil. So oil is made using bilwa, and they are extremely beneficial in hearing loss and so many infective condition of the ear. And the golden milk at bedtime along with the spices ginger, cinnamon, cardamom, and turmeric. And there is a wise practice to do, that you have ghee in empty stomach. It means before you take your evening meal, followed by maybe 100 to 150 ml of warm milk. And when you are doing all this practice and you think that there is no significant result is coming, then you definitely need to approach any of the practitioner to help you customize more therapies and herbs for you. And along with that, they can plan some of the panchakarma therapies for you. So most of the therapies like herbal fumigation, medicated head bath, and washing and clearing of the ears should be done under residential practice and under supervision. So I'm going to mention three therapies in detail. The first one is fermentation by a ball of drugs. So you need to prepare a ball of the drugs. You can take dashamula for that. Dashamula is available in the website. You make it into a coarse powder. You slightly roast them in sesame oil, and you put it in a cotton cloth, and you tie it similarly like it appears in the picture, and you massage your ear with sesame oil or with vata massage oil, especially focusing on the back side of the ears, because at the back side of the ear, in the just in the middle part, there is a marma which is responsible for the hearing. And if you regularly massage them, that can improve your hearing capacity. So after massaging it, you can warm your ball of drug, and you can gently press over your ears all over, including your jawline and back of the ears. And ear filling, so air filling is putting oil drops in your ears, but in Rashiganser practice, a lot of medicated decoction and intense herbs are also used. But for the home practice, you can use sesame oil, or you can use herbal inhalation oil for your ear filling. And if your ear is very itchy and it frequently itches, then you can use mustard oil, 2 to 3 drops of mustard oil in your ear early in the morning. Never put anything in your ear in the evening time, always in the morning time. And the another therapy is Shirobasti. Shirobasti is a compound is made in your forehead, and or medicated herbal oil is put in that basti, in that compound, and let it there for some hours, some time like maybe 30 to 45 minutes, and then it's taken out. Shirobasti is a wonderful therapy to cure many of the head related disorders and ear disorders, eye disorders, nose related disorder. And I do that, when this lockdown and everything is over, I practice practice that therapy in Cork, and maybe Dr. Rajvinder also practice this. So now let's move to the organ nose. So nose is the organ um, which is dominated by um, which is nose is the organ of kapha. Nose is the gateway to the head and also the opening to the respiratory tract. So which makes nose very important therapeutically, because we address nose to do our nasya, to do our pranayama, and to do neti. Nose, our nostrils is also very closely connected to the subtle energy pathways, which is lunar and solar channels. And this illustration proves the efficacy and the potency to address our respiratory tract via nose or via nostrils, whether it can be in the form of nasya or pranayama and neti. Some common problems with our nose is dry nose and a runny and stuffy nose. And stuffy nose can be very annoying, especially during the night time when we are not able to breathe and we are not able to sleep. So this runny and stuffy nose can be in certain conditions like allergic rhinitis, or maybe hay fever, or maybe in sinusitis. So
Here's what I found.
As per the Ayurveda, the allergic rhinitis is because of the weak immunity, and weak immunity is because of the external pollutants, improper diet, which leads to weaken our digestive system, and that doesn't lead our ojas to form properly, which is the substance to impart immunity. And this weakened immunity along with armor, which produced because of the weakened immunity, weakened digestive system, aggravates kapha, and kapha along with armor starts accumulating in our nose, and that leads to blockage of the nose. Another condition, sinusitis, can also lead to stuffy and blocked nose. That's because our sinuses, the mucous membrane of the sinus, get inflamed, and because of the inflammation there is a lot of mucus production, which makes our nose stuffy and blocked. And when and kapha, because nose is the organ of kapha, so kapha gets aggravated, and kapha acts on these symptoms and makes it more difficult to breathe in during sinusitis. And there's another condition of the nose which is dry nose, and that's because of vata aggravation, because of the cold and dry weather. So this runny and stuffy nose is very common to everyone, and every time you need to go to GP, you need to take some antibiotic, and a lot of thing. But you can address your runny and stuffy nose all your own. It's just that you need to understand few things, that whether it's because of allergy or because of the cough and cold, like how you need to address that. Before this runny nose condition starts, most commonly you will have sore throat 1 or 2 days before. So when you are in the sore throat stage, you can do gargle along with hot water, by putting a pinch of turmeric and salt in that. So gargle is bringing the liquid to your throat, and start moving the liquid and just spit it out, and you repeat the process till you finish the entire water of the glass. So if you do gargle in the sore throat stage, you either will not have any further symptoms, or maybe there will be very mild symptoms. And and you already have stuffy nose or runny nose, then you can take steam inhalation. You take a thick towel to do that, and you keep your windows and door closed so that no cold breeze come in. And you can do that with either MA634 inhalation oil, or maybe with caraway seeds, which helps to balance your vata and kapha, or with mint leaves. So you boil either caraway seeds or mint leaves in a pan, or in any pan or in kettle, and you pour it in a wide mouth bowl. You tilt your head, you wrap yourself with a towel, and you inhale steam from your nose, and you exhale from the mouth. And if you're doing that with inhalation oil, then you don't need to boil inhalation oil with the water, because that's the volatile oil that will evaporate. So So you boil your water and you just put 2 to 3 drops of inhalation oil in your water and you start taking your steam. As this sinusitis, allergic rhinitis, all these are the AMA condition. So you need to expel out those AMA, and you can do that by taking hot water frequently. But Ayurveda has told to do not take more water. So it's very common in the modern day that if you have runny nose, then take a lot of water to keep yourself hydrated. But Ayurveda has spoke completely opposite to that. It has strictly prohibited to take more water. It has advised to take water in moderation and only the hot or the warm water. So this hot water will help you to digest your ama and will also give you some kind of warm feeling as well. And herbs like ginger, cinnamon, and cardamom, you can make a clarifying herbal tea using ginger. Ginger will help you to liquefy your kapha. Cinnamon will help you to amplify circulation. It will increase circulation, and it also gives you some warmth feeling. And cardamom will helps you to channelize your doshas. So you make a clarifying tea, you store it in a flask, and you keep sipping the entire day. So, as this is a AMA condition and our digestive system has weakened, so we need to rekindle our digestive system. We need to strengthen our digestive system with herbs like trikatu, like ginger and cinnamon. And if you are your runny nose and stuffy nose is because of some allergic condition, then you can have Shitopladi powder, which is available in our website along with honey. The ratio should be 1:2. Or you can take Breathe Easy tablets, which contains holy basil, and holy basil is an excellent immunomodulator that helps to build up your immunity and that balances your vata and kapha as well. And then you can take Chyawanprash to strengthen your overall respiratory tract. The main ingredient of Chyawanprash is amla, Indian gooseberry, which is a good source of vitamin C. And vitamin C is a very good antioxidant, which will provide you to help build immunity. And then you can take Nasya. So what Nasya will do for you, it will help you to rejuvenate all the delicate mucous membrane. And if you use Nasya on a regular basis, then your mucous membrane will rejuvenate and gradually you will not have sign and symptoms of the sinusitis. Pranayama. So pranayama helps us to clarify all the channels, and it also helps to remove the stagnation of ama and improve circulation. So pranayama like channel cleansing pranayama, like alternate nostrils breathing, or hummingbird pranayama, or breath of victory ujjayi pranayama, or bellows breath pranayama can help you to clear your channels. And if you are dealing with chronic sinusitis, then regular practice of this pranayama can help you to pacify your dosha and to gradually come out with this condition of sinusitis. And you can massage your sinus area. So your sinus area is above your eyebrows and above your cheekbones with either eucalyptus oil or with herbal inhalation oil that will give you some warmth feeling and a kind of relaxed feeling and make you feel less stuffy. Or you can do marma therapy. So you need to gently massage your marma, which is located in both sides of your nose. So when you put your index finger, your first finger in your nose, where it's just going to set in, you gently massage there for 5 minutes. And when you do that, you will feel that your channels are getting clear. And then the neti pots. So a lot of yoga practitioner do neti pots. Neti pots helps to clear out all the dirts, pollens and mucus from the nose. You can learn this process and use that in your daily practice. But if you are doing everything and nothing is helping you, then you need a detoxification therapy. So for kapha, a different kind of purgation therapy and detoxification therapy is required. And detoxification nasyas are also recommended. So it's not like the same nasya which you do in your daily practice. That's the nasya with some pre-procedures like massaging, skin inhalation, and then you do take your oil with more of a dose, and that helps to clear your channel. And you do that once a while. That's not a regular practice. So I think we have covered everything with the nose. Now the oral care. So oral disease is one of the major health issues in many of the countries. In fact, I was reading somewhere that WHO has commented that oral disease is the fourth most expensive disease in worldwide and in some countries. So with the oral care, we suffer most with our teeth and gums. So common problems can be with our teeth. It can be tooth decay, or it can be cavities, or it can be toothache, or it can be sensitivity of the teeth. And it can be yellow teeth, or it can be bleeding problems of your gum, or it can be swollen gums. So every now and often your gums get swollen, and there is a bleeding, and that's a painful condition. So I've tried to categorize those common problems as per the doshas: vata, pitta, and kapha. With vata, all this cavity, decay, and toothache things happen. With pitta, there is a discoloration of your teeth and bleeding gums. With kapha, there will be swollen gums and bleeding gums. But with some regular practice of the oral care, you can cure all this mouth related disease, because mouth care or oral care is not only confined to this local part. It also affects our general and overall health being. So if we let a lot of bacteria gets accumulated in our teeth or in the oral cavity, then that can lead to certain infection condition, maybe a bacterial endocarditis, or urinary tract infection, bacterial vaginosis, or condition like pneumococcal pneumonia. So we need to address our oral health very carefully, so that we don't get anything, a very serious health condition, because of just oral bad oral hygiene, or maybe bad teeth or cavity. So the first thing we all do with our oral care is to brushing our teeth. But Ayurveda has recommended to brush your teeth with a herbal tea. So what's a herbal tea? Herbal tea are nothing but the stem of certain trees like neem, margosa tree, or miswak, which is also known as toothbrush tree. So you need to rub your teeth with the miswak or with neem twigs. You need to chew it, and you gently massage all over. But because this trees has antibacterial properties, and some studies shows that those who use herbal brush, the receding of their gums is much lower than those who are using electrical brush or the normal brush. But if you think that you are comfortable with your normal brush, then that's okay. Try to choose your brush which is very soft, or soft bristle, which has very soft bristle, and try to brush in a circular motion with a very light pressure. And try to avoid electric brush. Try to do that with the manual brushing, and try to use any herbal toothpaste, like we have Iodent in our website, or herbal tooth powder to brush your teeth. The second one is tongue scraping. So you can do tongue scraping with the tongue scraper, and that can be made up of any metal like a silver or copper or maybe steel. Tongue scraping helps you to remove millions of bacteria from your mouth, and also helps to stimulate some of the points in your tongue, some of the reflex points on your tongue. So in the early morning when you're brushing, and then you just remove all the amas and all the white coating is there in your tongue, and then you do an oil pulling. So oil pulling is a category of mouth rinse and a mouth wash. Mouth rinse can be divided into two parts based on what are you doing with your liquid. So if you fill your mouth with liquid and you just hold it, that is called gandush. And then you just fill your mouth, and maybe you just keep it in your mouth, the liquid, or you bring it to your throat and you move the liquid, then that is known as kavala. The oil pulling which we do in the early morning, that's one of a type of kavala or gandush which can be done with oil. But you can do oil pulling or your mouthwash with decoction, with paste, or with just honey, or with just milk, based on the condition what you require. Like if you're just looking for a daily care or with sensitivity of the teeth or dryness of the mouth, then you can use sesame oil. And if you're looking to balance your pitta and a kapha, then triphala along with honey. You mix triphala and honey, triphala powder and honey, and you do your mouthwash. You fill your mouth and you hold your liquid, and you then spit it out. Or if there is a burning sensation either in your mouth because of any blister or scalds, like you had very hot food, or in any part, then you can do your mouthwash with honey. You take 10 to 15 ml of honey and you keep it in your mouth and you hold it and you just rinse it off. For gum bleeding like situation, you can make your own decoction with dry ginger, muscat seeds, triphala and musta, and you fill your mouth, you hold it, and you just spit it. And for the toothache, you can use a glass of hot water with 2 to 3 drops of clove oil. You mix it properly and you hold the liquid in your mouth, you spit it, you again fill your mouth and you spit it, and within few minutes there will be no toothache. But you need to do that at least 2 to 3 times if you don't want to have any aches and pains in your teeth. And there are other recipes, other remedies as well, which I have mentioned in the handouts. So based on what you require, you can use that. And there are some people who just don't like this oil and decoction they don't like the feel of oil and decoction in their mouth. So what they can do, they can take hot water and they can mix a paste of sesame seed and mix it well, and they can do their mouthwash with that. So when you are doing oil pulling, how long do you need to do that? You hold the liquid till you feel that your mouth is filled with mucus. And another sign is that when you feel that your eyes and nose is also secreting some kind of liquid, so at that time you just spit your liquid out. The fourth one is tooth and gum rub. So that is called pratisarana. You can do that either with powder or either with any paste. So you make a mixture of some powder like musta and triphala. You take it in your finger and you gently massage all over your gum and tooth. Or you can do that with muscat seed. You take 10 ml of muscat seed and you mix a pinch of rock salt in that. You mix them properly and you gently rub. That helps to strengthen your gum and delays the process of receding of your teeth, and helps to remove some kind of plaques as well. And one more thing you can do for your tooth rub is that you can, if you don't like to use any herbs or paste or oil, then after you brush your teeth, you scrape your tongue, you go oil pulling, you just with the pulp of your finger very gently you can massage all over, and that really relieves your bleeding gums. There are some supplement herbs are there which helps to regeneration of your enamels, regeneration of your gum tissue, and they are amla, which is a rich source of vitamin C, and the another herb is licorice. So you can use them if you're suffering with any kind of chronic condition of the teeth. And now comes the most important and the very interesting topic, which is the skincare. So I remember myself, reading all the vlogs, which being a teenager, which has all the goodness of skincare, the beauty care, and a lot of people do that and they end up messing up with their skincare regime. So they want to try everything which is available in the internet or which is available in a blog. But before you do anything, you need to understand your skin. So what your skin actually requires, what is your skin type? So if you have a very thin, very dry and delicate skin, which can get scratch or which can get rash very easily, um, become very sensitive really easily, then you have a vata kind of skin. If you have mildly oily skin which is soft and warm, and they are very sensitive to sun, they get pigmentation, you get rosacea, or you get red kind of patches in your cheekbones, or like all over your face or skin, then your skin is of pitta type. If you have a kapha skin type, then your skin will be very plumpy, that appears very soft, very lubricating, hydrating, oily, and big pores are there, and your skin touch to be like very cool. So now you know that what your skin type, then how can you address your skin needs? So if you have a vata skin type, then it's very dry. You need to moisturize your skin. You need to hydrate it. You can do that by having ample amount of water, by having fruit juice without mixing any sugar in that. You can do moisturization of your skin using natural moisturizer like coconut oil, almond oil. And if you have a pitta skin type, then you need to protect your skin with excessive sun exposure from dust, allergens. So if you are planning to go out during the daytime, you apply your sunscreen, or when you come back home, you wash your face and you apply a generous amount of aloe vera. Or maybe if you have to stay out for a long hours, then you can take a spray bottle filled with rose water, and whenever you feel that your face is becoming very hot and oily, you just spray once or twice the rose water, and that makes you feel calm, and that cools down the temperature of the skin. And if you have a kapha skin type, so they're more prone to clog their pores, because they have oily skin, they have big pores, so it can easily clog your pores. So you need to focusing on exfoliating your skin at least once or twice a week. For that, you can either use gram flour, or you can use honey to reduce the oiliness of your skin. So here, our skin routine should be three most important things should be there, which is also known as CTM. So cleansing is very important, because you need to take out all the dirts and all the dirt particles, and all when you're cooking, the fumes and the oily thing which gets accumulated in the skin. So you either use a very herbal based face wash, or you can do that with cotton. You take a cotton ball, you dip it in the raw milk, and use it all over the face, and leave it for around few minutes, maybe 1 or 2 minutes, and just wipe it off with gently with white, very fine cotton muslin cloth. You need to tone your skin. You need to strengthen your collagen. For that, you can use rose water. You can either spray that, or you can use that with the cotton pads or cotton ball. And you need to moisturize your face, because your skin needs hydration. That's the most exposed part of our body. You can do that with aloe vera gel, or you can do that with coconut oil. So these three things are our daily routine. But if you are looking for some extra care of your skin, then once a week you need to exfoliate your skin. You can use natural exfoliators like oatmeal. So you take oatmeal and you make it into like coarse powder, and based on your skin type, you can either, for vata and pitta, you can add milk, or for kapha you can add honey with the oatmeal, or red lentils, which is also known as masoor dal. You make a coarse powder of that, and you gently rub on your face in the upward motion in a circular way, to remove the dead skin of your face, so that your skin can get its natural glow and it can breathe properly. Gram flour is an excellent exfoliator, and that's the must ingredient in all the face pack in India. And then the next thing, after you cleanse your skin, you tone your skin, then you exfoliate your skin. After that, you can apply a face pack. So face pack helps you to help you build up more collagen, that brightens your skin texture, that moistures your skin, and that imparts some of the nutrients in your skin as well. So how you need to do your this process is that you make your herbs in a very fine smooth paste. For vata, it can be gram flour, turmeric along with yogurt. For pitta, it can be honey and lemon. For kapha, it can be honey and neem powder. So you mix them properly and make a smooth paste. And when you're applying that, you need to apply in the opposite direction of the hair follicles, in a massaging way. So when you massage and you apply in the opposite direction of your hair follicles, then you stimulate your hair follicles, and the face pack goes deeper inside, and you can take most use of that. When the face pack is almost dry, like around 82 to 90%, you don't let it dry for too long. Otherwise your skin will become very dry if you leave it for too long. Ideally you need to leave it for 15 minutes, 12 to 15 minutes, and not more than that. So once you find that your face pack is dry, you splash some water, you gently scrub that, you gently rub that your face pack, and then you just wipe it off. You're done with exfoliating your face pack. Now you need to provide some extra supplements, some extra nutrients to your skin. And you can do that with Kumkumadi Tela. So Kumkumadi Tel is a oil which is made from saffron and saffron like substances that helps to improve the texture of your skin, that imparts radiance to your skin, and with the regular use there will be no scar. It will reduce the pigmentation as well. Or you can use radiant skin oil with that. And in your face pack you can use certain essential oils like neem oil if you have acne condition or a scar condition. You can use lavender oil if you have dry or sensitive skin. But those were just the external factor, and Ayurveda believes in the mantra that beauty comes from within. So a good texture of the skin comes from within. So we need to focus on balancing of our inner self as well. Stress can make our skin really dry, really sensitive. There can be itchy skin. I remember one of my client telling me that her skin has become very itchy and dry, and she was using all the regular and usual products. So when I asked her, then I got to know that she was in some stressful condition. So you need to balance your mental peace. You need to calm down your stress. You need to find positivity and in your inner peace with exercise, with yoga, with pranayama and meditation. Next factor can affect our skin is sleep. So our circadian rhythm is not only important for the skin but also our overall health. So our skin needs 7 to 8 hours sleeps. So it's not about you sleep at 12 o'clock and you wake up at 10 o'clock. You need to sleep in the correct time. You need to maintain your circadian rhythm. And when you sleep, your skin also breathes. So try to sleep on the proper time. Your bedtime should be 10 o'clock and you wake up before the kapha time starts at 6 o'clock. Environment plays a great role in affecting our skin health. So a lot of pollutants, dust, pollens affects our skin and makes it very sensitive. So you need to cleanse your skin twice a day, morning and night, especially when you go to bed. So if you clean your pores which are clogged with environmental pollutants, then you let your skin to breathe properly. And all this lockdown phase, we are at home and we think that we don't need to cleanse our face before we go to bed, then we are making a mistake. So our pores get clogged when we are cooking, when we are doing dusting in the house. So you need to clean your face before you go to bed, and you should make it a regular practice. Diets which are rich in vitamin A, C, and E. So vitamin E helps to remove all the free radicals from the from the body, which is the source of producing many health conditions and disease, and that also causes premature aging. Vitamin C helps to form collagen, and vitamin A helps to keep our skin hydrated, and absence of vitamin A can lead to dry skin. And minerals you can avail source from nuts and seeds. And to detoxify your skin, you need to add more of a color. So you need to eat 5 portion of your fruits based on the skin type, more colorful fruits and vegetables. So you can make your own ratio, maybe 2 fruits and 3 vegetables, or maybe 3 fruits and 2 vegetables. And water. So water is of the very good friend of your skin. You need to keep your skin hydrated. So have ample amount of water, but warm water, not water from directly from the tap or from the bottle. You boil your water, you let it come down in the room temperature, and you have it. So when you boil your water, it becomes easily digestible, and that's more hydrating for your skin. So I have shared few remedies of the face pack based on suntan, based on skin texture, based on pigmentation in the hands out. So if your skin is tanned a lot, then you can use sandalwood and aloe vera that helps to remove the tan, or you can simply use cut slice of tomato to rub all over your face. So lycopene in tomato helps to remove all the tan from your skin. And turmeric helps to lighten your skin, and that's an anti-inflammatory factors as well. So if you have inflammation condition or pigmentation, that can help you. Manjishta and red lentil powder also helps to reduce pigmentation. And some fruits like banana, which helps to strengthen the collagen of your skin. Papaya helps to make your skin more radiant. And if you are suffering with some health condition of the skin, then it will be it will be good that you take a help of someone before trying out anything, because that might make your skin more sensitive by trying some of the face packs or like anything. And so I have mostly focused on exfoliating and massaging kind of skin, because your skin needs hydration in forms of massaging and your dead skin to be removed. And for exfoliating your body, you maybe try coconut oil with rock salt or maybe sea salt. That makes a very good scrub for your skin. And also you can try with coffee, ground coffee, but you know that stain your fingers and all. So if you do that with rock salt and coconut oil, that's gentle and mild on your skin. So this is all from the skincare. Now I would like to share a recipe with you all, which is semolina porridge. So when I discuss the guide with my clients, so it becomes multiple option for their lunches and for their lunch and for their dinner, but it always become very minimal option with the breakfast. So I thought of sharing my favorite breakfast option with you, which is semolina porridge. So semolina is a kind of flour which is made from a kind of wheat which is durum wheat. And this has a low glycemic index than wheat, and it's rich in source iron, copper and magnesium. And that's also a good source of fiber, so helps you keep your bowel clear, vitamin B complex and vitamin E. And if you are looking for a weight loss program, then this is the best breakfast for you, because it's zero in fat, saturated fats and trans fatty acid. They are rich in dietary fibers as well, and they have a very slower rate of digestion and absorption. So it keeps your blood sugar in control and you don't feel hungry very frequently. So all you need to, and that's very quick to make as well. So all you need to do, you take the required amount of semolina in a pan, you dry roast them, and then you mix a teaspoon of ghee in that and you keep roasting them. And then you add a handful of nuts in them, finely chopped one, so that it becomes easily digestible for you. And you roast them and you just add either hot water or plain water in them, and your porridge is ready. And if you want to make it more sweet, then either you can add jaggery or any natural sweetening agent to sweeten it, or just raisins or dates to make it sweet. So thank you. Hello, Noel.
Hi, Dr. Nahid.
Hi.
Start off my video. So that was great, fantastic, and there's a huge amount of information in there. So I think people shouldn't worry too much about the fact all the information that was in there. We'll send you a recording of the video, so you'll have a month's access to it. So you'll have plenty of time to go back over all the different points. I mean, I know some people were more concerned about the eyes, and some people were concerned about the ears, and someone sent to mention about tinnitus in there as well, which Dr. Naheed did. So you can go back over it in your own time. And you can pick up the different points that you're unclear about. So Dr. Naheed, I think there's a huge amount of questions in there.
Yeah.
So there's no way we're going to get through them all, but if you want to take some of them maybe, and if you want to take some of them, I'll let you pick them yourself. If you want me to pick them out for you, I can, but you can see there's lots of them there.
So I take starting from eyes. So what's the causes of watery eyes? Also the dry eyes. So dry eyes is a condition because of vata. So maybe if you're using screen too much, that makes your eyes dry, and that can make your eyes watery as well. So you can use ghee the way I explained during that. Either you can do that with just massaging or with the Optrex eye bath, the warm ghee, and your dryness will reduce, and that will also help you to reduce the watery condition of the eyes as well. And the next question, wash 3 times weekly. So there is please do cover tinnitus. Tinnitus is a condition because of the imbalance in your vata, and that's a chronic condition. You can do that. You can try to balance and reduce your tinnitus with balancing your vata. So you can do that with the process I told, to massaging your ear and doing that fermentation with a ball of herbs. So with herbs called dashamul. So dashamul is a herb of 10 herbs, and the roots are taken. All the herbs are taken, the root form of all the herbs has taken, and they are collected and called as dashamul. You make them coarse powder, you fry that in a pan using sesame oil, and you put it, you tie it in a bag, and you can ferment, compress all around the eyes. That will balance your vata, and that can reduce your tinnitus.
Yeah, Dashmul powder is something that we actually have. We don't have. I've ordered more of it from India. We have some of it in stock, all right, but it's Dr. Rajvinder seems to prescribe it quite a lot. I hadn't heard of its use for that before, but I mean, we have it on our website, but we'll be running out of it soon. But we will be getting more in from India. We will be getting more.
Yeah. So someone asked, what is Nasya? So Nasya is a process where you apply or where you instill oil in your nostrils. So if you're applying, you can use your little finger very gently. You do not have very long nail, because there is a area, very sensitive area in your nose, which is known as Lickle's area, and injury to that can lead to bleeding from the nose. So you try to do that very carefully. Or you can simply use MP16 nasal oil, which has a lot of herbs to balance and to give you more benefits of the nasya. Just spray it by tilting your head like this, close one nostril and just put one, and then again close the another one and put the oil in the another nostril. And do not sniff it very forcefully. Try to sniff gently, and try to keep your head in this position for a while, so that oil can get inside and not come out from the nostril.
Actually, I'll put a little video up on our channel about how to use. We have an applicator, a spray applicator, which makes it very easy to put the nose our fluid up your nose. So what I'll do is I'll make a little video of that, and I'll put it on the website.
And all the herbs which I have mentioned, like Triphala, licorice, or bilwa, or anything, everything is available in our website. So based on what you need, you can go and search in the website www.ayurvedacenter.com. And you will be able to find all of the herbs. So nothing is out of from the list.
Okay.
Everything is there.
And one thing, Dr. Naheed, like Triphala tablets seem to be a lot more popular with us than Triphala powder. I mean, you were talking about, you know, mixing it with water at nighttime and stuff like that. But the Triphala tablets, you know, the tablets we have, people seem to prefer them an awful lot more. So they're fine. They're okay to take for the eyes as well.
Yeah, they are okay to take Triphala powder, and you can have your Triphala tablets, and then you can have your ghee after that. Or maybe you can just ground your Triphala tablets and you can mix it with ghee and you can have it.
Okay, well, if someone wants to do that, they're better off just buying the powder. The powder is on the website as well, the Triphala powder, you know. So, but the Maharishi Ayurveda Triphala tablets are, well, that's probably our best-selling product, you know. But if you want powder, it's on the website as well. And the easiest way to find anything on the website is just use the search bar on the homepage. Just type in whatever you're looking for, and it'll come up, you know. Don't go looking for it in the shop. There's too many products. So just put it in the search bar, you know.
And Anna asked that, do we wash off the ghee after the time allocated? So you don't need to wash it with water. You gently wipe it with a very soft cloth, or maybe you can dip that cloth in warm water, in hot water, because you know the hot water helps to remove the greasiness from the eyes. But do not splash water or like with the face wash. So try to do that when you are staying home at that day.
Yeah, I've done Netratarpana before. As a pitta, I found it quite difficult because you have to open your eyes and it tends to sting a little bit. I mean, if you're kapha, you probably wouldn't even notice it, but as a Triphala, but it's very, very good. I mean, it's a little difficult to do, but it's very good afterwards when you have it done, you know. So it's, yeah, no, it's a very good thing to do. And, you know, you really need to go to you know, you need to go to an Ayurvedic doctor or a technician to do it, to make the tarpana and put it around and put the ghee in. Dr. Rajvinder does it, and Dr. Naheed does it as well. And any of you that have been on Dr. Rajvinder's yoga class on a Saturday morning, or the class that we do, know that she does eye exercises as well. She started doing eye exercises, which are, I mean, I find them really, really good because I'm pitta, so very much in the eyes as well. But the exercises she does a lot of, some of the ones that Dr. Naheed mentioned there, but you do get the tears coming out of your eyes, which is cleaning out stuff, you know. So mostly, I can't guarantee she'll do it every Saturday, but mostly she does it on a Saturday morning, you know.
Yeah, when you do your eye exercises, be very gentle. Do not put a lot of pressure while doing your eye exercises. You know, you can simply start with blinking eyes and then slowly introduce yourself with some of the exercises. And initially, you just do once or twice, and then gradually increase to a certain level to make your eye adapted to your eye exercises. Otherwise, your eyes might feel very, very painful. And there is a question about bags under the eyes. So you can grate some cucumber and you can put around the eyes all over here, and that will help you to reduce the bags in your eyes. Or maybe you can use tea bags. So after you use that from your tea, you just store it. You maybe keep it in your refrigerator for a while. It becomes cold. So if you apply something cold in your eyes, that's not too harsh to do, because your eyes is the organ of pitta, and pitta loves cold thing. And you just put it, and that will help to reduce your bags under the eye. Anna asked, can we practice eye treatment if we have no problem with that? You can do that for just, keeping your eyesight and your vision clear. And that will also help you to prevent any eyes related problem in future.
So there's a question there. How do you treat dry skin in the ears due to the effects of chlorine as a result of swimming? So I imagine a little abhyanga on the ear might be very good, but maybe you have some other idea.
Yeah, abhyanga on the ear can help.
Sesame oil, and massage them.
Yeah.
Yeah, very good for Vata people anyway. Massage the ears, you know.
And if you have itching condition with your ears, then you can try mustard oil. You massage with mustard oil, or you can put 2 to 3 drops of mustard oil in your ears. There is one question with red eyelids. You can try rose water. So redness of the eyes can be relieved with rose water.
You can get rose water in a little spray. It's brilliant. Just spray. I keep it in the car actually. If I'm stuck in traffic and the pit is going out of balance, just spray it on your face. It's rose water is very, very cooling. You can also drink it. You can put some in just a little teaspoon in a glass of water. Very good for pitta people and very good for the eyes. So just get yourself a bottle of rose water spray. Get a good quality one, an organic one, and then just spray it on the eyelids. Can you help reduce vertigo?
Yes, vertigo is also a condition of Vata problem. So vertigo can be a cure with the practice of Nasya, with the practice of pranayama, with the practice of oil in the air, and with certain herbs can help you to reduce your vertigo.
Yeah, I think it requires, it's a serious condition. It requires a consultation and a proper program from an Ayurvedic doctor, you know.
Please be specific regarding how to put drops in the air and what should be the outcome. So you need to take a dropper. So dropper, I think everyone is familiar with the dropper, and you fill it with the oil and you tilt your head like this and you put 1 or 2 drop in your ears and be there so that the oil doesn't come out from here, and just be there. Again you tilt the another side and you put the same way. The oil will not come out after that if you keep your head like that. And this process is called karnapuran. Someone asked what is karnapuran. So filling your ears with decoction or with any medicated oil or with just simply the oil is called karnapuran, which is good for the sense of hearing, which delays the process of hearing loss and overall health. Overall the health of your ear, that's good, because that's the organ of Vata and that's need lubrication. Vata loves oily thing. Vata loves lubrication and massage.
So someone asked about putting bilva oil in the ears. I'm not even sure where you get bilva oil, but
Yeah, bilbo oil, it's not available over there. So, do we ingest the castor oil? Yes, we can ingest the castor oil. This is for some of the detoxification therapy. We use castor oil, and castor is a very good Vata balancing herb. And oil, anything in the form of oil, works better with Vata. So, you take 5 to 10 ml of castor oil at night if you're suffering with chronic constipation, or if you're suffering with any condition, chronic Vata related condition.
so Lisbeth asks how to do hummingbird pranayama. Again, it's one that Dr. Rajvinder does a lot. Otherwise, just Google it, go to YouTube and Google it, and you'll find out how to do it there. But Dr. Rajvinder does it nearly every week, you know.
Someone asked what is neti. So neti is a process usually in yoga practice, very famous in yoga practice. So there is a pot which is very narrow kind of nozzle. You put water from one nostril and it comes out from the another nostril, and it helps to come clean your nose. Maybe if you have to add something on the neti nose.
Yeah, well, I mean, all that cleaning area, when I did my yoga teacher training in Rishikesh, you know, they were very keen on getting us putting things up our nostrils. I mean, at one stage they were trying to get us to put a cloth up here and take it down the other side. And I tell you, that was quite difficult. But certainly the water, the saline water is quite easy. You just tilt your head and you have a little pot and you put the water up there and then it just comes down the other side. It will bring tears to your eyes the first time you do it, but you know, you feel good afterwards. It clears up that whole area, you know. So yeah, it's a good thing to do as along with the Nasya, just using saline water. Actually, Ashleen Swift there says hummingbird pranayama. So we've 2 birds in that name, Ashleen Swift. Hummingbird pranayama, several videos on YouTube. So you can, there's a link there showing people. Now, I can't guarantee the quality of them or anything like that, but they are there, you know, if people want to look at them, you know.
And Noel, someone is telling you we need neem twigs, please.
We need which? Neem twigs. Yeah, we have neem powder and neem oil, all right, even though I'm finding it hard to get neem oil at the moment. But neem powder we have. Neem twigs, yeah, it'd be great if we could get them, but I don't know.
But you can get miswak, the toothbrush tree, in any of the Asian shops. They are available in Asian shops. So maybe.
What is it, Dr. Naheed?
Miswak. So miswak, they come in the name of miswak, and the name of the tree is toothbrush tree.
Toothbrush. And is it a neem? Is it a neem twig?
No. That's a different plant.
Okay,
that comes different.
Actually, I'm doing this Ayurveda course at the moment, and we were talking about the mouth area the other day, and the Ayurvedic Vaidya, the doctor that's given the course, was very emphatic not to use a hard toothbrush. To use a she said there's lots of very sensitive areas in your mouth, and not to use, if you're going to use a toothbrush, not to use a hard one, use a very soft one, because you can easily kind of aggravate this area. So you use a very soft toothbrush. I know an Ayurvedic doctor who said he stopped using the toothbrush altogether. He just uses tooth powder and just uses his hand to clean his mouth and everything like that, and said he's found it much better, you know. And use a herbal toothpaste, a good herbal toothpaste if you can get one, you know.
And someone asked, care of throat for singing, any recommendation? You can prepare your herbal tea using licorice, cardamom, cinnamon and ginger. If you're a regular singer, that licorice is very soothing for your throat, and you can do gargle every single day, either with licorice decoction or with just plain warm water. That will help you to soothe your throat. And one thing I forgot to mention, that when I was mentioning about the mouthwash, Ayurveda has mentioned to rinse your mouth every time when you have your food with warm water. So it's the lukewarm is available in the tap very easily. So once you finish your food, you go to the bathroom, you take some lukewarm water, with your hand, and you keep it in your mouth for a few seconds, and you just spit it out, and you then again rinse your mouth. So that removes all the foods which get accumulated or like stuck in between the teeth or below the tongue of it. So it will clean, and that will not like bacterial growth over there.
Actually, we got a new gum care oil, but we've completely sold out of it. No, we have to get more of it back into stock. We completely sold out of it, but we will have that back in stock. It's just proven a little difficult to get products from anywhere these days at the moment. This whole Brexit and COVID thing is made life a little difficult for getting products in from places. But hopefully we'll have it here in the next week or two, you know.
Okay.
There's one there. I just want, for skin and pitta conditions, Dr. Brennan guided me via a consultation to help me do a home cleanse along with herbs from the Ayurveda website. My skin has never been so good. The boiled hot water is also key. I would highly recommend a consultation with one of the doctors if you have ongoing skin issues. You will be guided for your specific needs and issues. I can't recommend this individual consultation enough. Yeah, no, thanks very much for that. I think that's Mary Jane. I can't see the whole thing there. Yeah, I mean, I always say it on our webinars. These webinars are fascinating. There's great knowledge given out about them, but there's nothing beats having your own private consultation with a doctor, because Ayurveda is individual to the individual. So there's never going to be exactly the same recommendation for just because you happen to have a condition that somebody else happens to have that condition, because Ayurveda is never treating the condition anyway. It's always treating the person, and the person is going to be different from one person to another. So the best way is always to have an Ayurvedic consultation if there's something that's of serious concern to you, you know.
So can you recommend anything for sun care for the skin? So aloe vera is good for sun care. Sandalwood is good for sun care. Tomato is good for sun care. So if you're exposed to sun for too long, you come back, you take a generous amount of aloe vera, you apply it all over. Or if you have a lot of suntan, you can rub tomato slice all over your face for a week, and then the suntan will reduce. And if you have burning or rash sensation because of the sun, then you can mix aloe vera gel along with sandalwood powder. Sandalwood powder is also available in our website. You mix them and you apply that. Or you can use radiant skin oil to lighten your skin and to reduce the pigmentation because of the sun.
So we're getting very close to closing time here. I just read some of these. Elaine Bracken says, great webinar, Dr. Naheed. Thanks. Anne Keane says, thank you, Dr. Naheed. Sarah Palmer says, thanks so much. I can't read the rest of that. Patrina says, thank you. Do you have the eyes open with the eye bath? Yes, I presume you do. Really wonderful, says Ali. Thank you very much, Elizabeth Whelan. Just lots of thanks. Should we replace Specsavers eye drops with Ayurvedic eye droppers with Ayurvedic method? Not too sure what that means. Specsavers eye droppers. They must have some little eye droppers, but I think the eye droppers would work okay as well, would they, Dr. Naheed?
Yeah, so they are mostly made of, kind of dilating substances, chemicals. So they help to dilate, and they help to also cut down drying of the eyes by just lubricating them.
Okay. So Karina Askin says, thank you.
Something is there in the eye drops.
Okay, so lots and lots of thank yous there. Okay, everybody, I never like going past 9 o'clock. The day is long enough. So Dr. Naheed, that's fantastic. I think it was a really, really great webinar. And let's see, we still have 220 people on. So that's roughly what we started with. So That's obviously people were held. They were interested, so they stayed on. You know, so that's great, everybody. I'll send out. I noticed some chat saying I didn't get the notes. You more than likely did. They were an attachment to your email. You know, but don't worry about it if you didn't get them. When I send the video link, just give me a chance. Not first thing in the morning. Give me a chance to get it out to you tomorrow at some stage, and I'll include the notes again. I'll include the notes again as a Word document attachment, okay? And the notes will be in it, and you'll have a link to the YouTube video, and it'll be active for 1 month. So you have 1 month to go back over and review the thing, you know. So, and as I say, then if anybody specifically has, you know, issues that they feel that Ayurveda is a good way of dealing with whatever it is, then Dr. Naheed is doing consultations. You can book your consultation with Dr. Naheed online on our website, ayurveda.ie. She has her time set up there. She does them from India, but that's fine. It doesn't make any difference with Zoom, but her times and her dates are there. So you can click into that. So I'll finish with one last comment. It's from Madeline to everybody. She says, thank you, mind-blowing, glad I have the notes. So there you are. Okay, Madeline, thanks very much for that. Dr. Naheed, thank you very, very much. It was wonderful.
Thank you, everyone. And if someone have any question, they can email me and I'll try to get back to them as soon as possible from my end.
Yeah, you might regret saying that, Dr. Naheed, you know, but anyway, so Naheed at ayurveda.ie, but, you know, if you have simple questions, but don't turn your simple question into a consultation, please. Just,
yeah. It's just related to what I have mentioned in the Hangout. So if it's something makes you difficult to understand, then I can clarify them.
Clarify the point. Okay, so you'll be spending the next month on the computer answering emails, but anyway, okay, no problem. Namaste, everybody. Have a great night.
Everyone. Bye-bye. Have a nice day.
Bye-bye. Thank you for everybody. Big thank you to everybody who came along, and we have lesson 5 of our Ayurveda course tomorrow. Our new Ayurveda course is starting on the 27th of April. So please, it's the free one, the 6-lesson free one. So please tell all your friends about it. It's on our website. It's the main banner on our website. The new free 6-lesson course featuring, of course, Dr. Naheed and Dr. Brennan and Dr. Rajvinder, and I'll be the compere on it again. So definitely get as many of your friends. It's absolutely free, no cost to it. So it's a fantastic introduction to Ayurveda. I'm sure most of you have done it. So get your friend, get your friends to come on and join in and subscribe to that particular webinar. Okay, so was the 8-lesson course reduced to 6? It's a different course. It's our own course. It's not the original 8-lesson one. It's our own course, and we've done an additional lesson, which is the 6 stages of disease, which we'll run again. We had nearly I think we had 700 people on that there a week or 2 ago, you know. Anyway, I'm not going to go on much longer. We could talk all day here. Thanks a million, everybody. Thank you. We'll see you all again. Thanks.
Bye.
Thank you. Bye-bye.
Bye. Good night.